Hi friends, today we are discussing vaginal delivery versus lower segment cesarean section. So friends, at the end of beautiful pregnancy journey, all our patients end up at the same dilemma, whether to deliver vaginally or through cesarean section. Now let me today throw some light on both the methods. I'm Dr. Deepti Asthana, Senior Consultant and Obstetrician Gynecologist in Fortis Memorial Research Institute, Gurgaon, and Director of Kalosa Clinics. Connect with me on Instagram or subscribe my channel Kalosa Gynae for all female reproductive health updates. You can also visit my websites drdeeptiasthana.com and kalosaaesthetics.com. Now, when it comes to birth of a baby, vaginal delivery is often perceived as nature's chosen way to deliver a baby, and actually has been a primary mode of delivery since ages, because of which cesarean section is still considered to be a taboo. There's always been this debate about whether cesarean sections are easier options because some mothers do not want to endure the pain of vaginal childbirth. Well, everybody has different opinion on this. Now let us analyze both the methods in detail. Now coming to pros and cons of vaginal birth. The pros of vaginal birth are as follows. Now this is the best way to deliver a baby unless there is an obstetrical reason to do cesarean. It is less morbid for mother with lesser blood loss and early recovery. Now with better monitoring facilities like CTG and advancement in pain management, a woman doesn't necessarily have to be in pain if she chooses a vaginal delivery. There are many options like epidural analgesia, touch and massage, water birthing, acupuncture and hypnosis. These can all be beneficial for the management of pain during a vaginal birth. Now, partograms are diagrams which are drawn to tell us the progress of labor, and they can actually tell us whether labor is going on fine or not. Any delay may signal probable obstructed labor and helps obstetrician to stop trial and need to intervene. Now, if we look at the cons of vaginal birth, it can lead to injury to mother's birth canal if undue prolonged labor or forceful vaginal delivery is conducted. Now, there are some very bad perineal injuries which result in anal sphincter tear, also which results in affecting the quality of life. Now, if they're large babies, especially in diabetics, these can end up in shoulder dystocia or axillary nerve injuries, which can be disastrous at the end of a wonderful pregnancy journey. You cannot afford to give such babies to the mother. Also, difficult deliveries may sometimes cause fetal hypoxia and result in cerebral palsy babies, which is really a very sad event, and mothers do not deserve this. Now, it is also difficult to predict the duration of labor. Some patients may be in labor for 15 to 20 hours, and nobody can actually predict with 100% accuracy that with so much of waiting also, vaginal delivery is a surety. Many such patients feel disappointment at the end in accepting operative delivery in spite of bearing for so long. Now coming to lower segment cesarean section, this is a school of thought that suggests C-section deliveries are life-saving operations that can and must only done when the patient and the doctor have exhausted all other options to ensure a natural delivery. Some believe it is a way to escape labor pain, whereas others believe there is no need to lionize the pain of childbirth and that women deserve a comfortable and less painful experience. Of course, with better surgical facilities, antibiotics and safer anesthesia, C-section is a safe method of delivery. In some pregnant women, vaginal delivery is unsafe for either mother or the baby or for both. If the treating obstetrician has suggested you that a cesarean section is needed for safe delivery, then the patient and the attendant should not be apprehensive and should respect the doctor's decision. Now let me summarize the pros of cesarean. Now this is the only safe way to deliver a baby when the mother has a small bony pelvis with a large baby and the conditions which we often label as CPD or cephalopelvic disproportion. It is a life-saving operation in certain indications like placenta previa, fetal distress, etc. It can be planned electively, so one can ensure the presence of the best surgical anesthesia and pediatric team along with the patient being in an appropriate fasting state. Nowadays, patients can often choose time and date of the cesarean also, which we call as Muhurat cesareans. Now, what are the cons? Now, it's a major surgery in which all the layers of abdomen need to be cut and stitched back along with the scar on the uterus. So there are higher complications for the mother, both related to the surgery and the anesthesia. There's increased maternal blood loss also. It is likely that the next baby would need to be delivered by C-section if you have a previous cesarean section. Now let me tell you my mantra for mode of delivery. Now if there are clear-cut indications for cesarean section depending on maternal and fetal conditions as assessed by your obstetrician, please abide by her decision. If your doctor feels vaginal delivery is safe and possible for your baby, go for it. With continuous monitoring and vaginal findings, decision can be taken regarding progress of labor. Partograms are also very useful for such purposes. Believe me, as an obstetrician, only thing which matters to us is safe mother and the baby at the end, as every childbirth is precious. Thanks for being glued to the video. Hoped it helped you, as would other videos on my channel Kalosa Gynae. Also visit my websites drdeeptiasthana.com and kalosaesthetics.com and connect with me in other mediums such as Instagram. Thanks and take care of yourself. Bye.